Welcome to our poster presentation, The Role of Homeopathy as a Preventative Measure in Reducing Antibiotic Resistance. This is a literature review done by myself, Reem Sharhan. I am a fourth-year naturopathic medical student. The study was done under the supervision of Dr. Nazanin Vesigi, who is a licensed naturopathic doctor and assistant professor at Bastyr University, California. The content of this presentation will entail an overview of proposed theory, a review and summary of findings, which will include preclinical and clinical evidence of immunomodulatory properties of homeopathic remedies, a conclusion, application and future consideration, and we finalize with a summary. The proposed theory is overall, we propose a theory where homeopathy can work alongside antibiotics, whereas antibiotics work directly on microbial agents by destructing their cell wall and internal organelles. Homeopathy, on the other hand, can work indirectly by stimulating the body's innate ability and its immune system. It stimulates the innate ability to heal. Therefore, it can expedite microbial degradation and disease elimination. Based on that, we conducted a thorough literature review where we extracted evidence of immunomodulatory properties of various homeopathic remedies in vitro and in clinical studies that support the overall purpose of the study. Here we show the important papers that we extracted, divided into three categories. That's in vitro homeopathy alone, in vitro homeopathy with antibiotics, and clinical studies where homeopathy is compared to placebo controls. And we'll get into the details of each individual category in the following slides. In vitro studies show that various dilutions of homeopathy exert a multitude of effects on the immune system, be it direct activation of genetic expression, up or down regulating various cytokines and anti-inflammatory agents. Some of the findings we see here is Rustox, which is a homeopathic remedy, found to exert a chemotaxis effect on polymorphonuclear leukocytes. Mercurius significantly increased macrophage spreading, increased interferon gamma at low potencies, and interleukin-4 at high potencies. Belladonna and echinacea used together versus placebo controls increased polymorphonuclear cell migration, increased phagocytosis, decreased mononuclear cell percentages, and leukocyte degradations. All these findings support the immunomodulatory properties of these homeopathic remedies. A notable study we found where the effects of homeopathy combined with antibiotics was studied on MRSA growth, on the growth of MRSA in vitro. The homeopathic remedies chosen for this study were belladonna or MRSA nosode, and then were combined with oxacillin as an antibiotics. Results show significant reduction in MRSA growth, as seen in the graph here. The bacteria was either cultured on a sterile water as a control, as seen on the black line on the graph. And then or with belladonna or MRSA nosode 6C or 30C potencies, as seen in the blue, gray, green, and the brown lines on the graph. These cultures were combined with oxacillin at different concentrations, as seen on we see that on the axis on the graph. And then bacterial growth was measured with a spectrophotometer at 600 nanometers as seen on the y-axis of the graph. Needless to say, significant differences were seen between the treated groups versus the control group. The increase in the vulnerability of the MRSA to oxacillin in the treated groups indicate that homeopathy has a direct action on microbes, which extends beyond the presentation and the general theory that we present today. This can also indicate that antibiotic resistance can in fact be reversed. Clinical studies showed that there's a generalized improvement in overall health parameters, such as weight gain and anemia in TB patients and TB cases. There's a decrease in susceptibility to infection, as seen in reduced transmission rates in E. coli infected piglets, suggesting homeopathy has a direct effect on increasing organisms' resiliency, likely through the amplification of the organism's adaptive network. These studies also suggest that homeopathy shortens the intensity, frequency, and duration of disease. The end result is the elimination of microbial agents at a faster rate, which can reduce the duration of exposure to antibiotics and potentially minimize the disease recurrence. All factors are important in prevention of antibiotic resistance. In conclusion, the review suggests that homeopathy can be a viable, cost-effective option to reduce the burden of drug resistance on the healthcare system. Homeopathic treatments in the livestock sector can be a solution to lower the current use of antibiotics in the animal population and improve the resistance rate in those populations, which can indirectly reduce the rates of resistance in humans and reduce the chances of new drug-resistant organisms from developing. Future considerations for the study is to gather further evidence to support the clinical portion of the study. A particular focus will be given to the homeopathic remedies that proven to have immunomodulating effect in vitro. This task can be a bit challenging given the heterogenic and personalized nature of homeopathy trials in terms of design, personalized interventions, and diverse outcomes. In summary, there are some studies that investigate the importance of homeopathy along with antibiotics in treating disease, but there is still room for research. The research needs to be done upon which we can modify the way we currently treat disease with a goal to evade antibiotic resistance and drug abuse. This concludes our study today. Thank you for your time and for listening.